So supraspinatus, infraspinatus, all good, right? And अपने spine, मतलब बस अपने आप को tap करो. हाँ, thing is, when you do like this ना, every time when you study, again, this was asked, every time when you study, if you touch like this, right, तो एक साथ दिमाग में it will be generating what is called as the neuro-linguistic programming. Neuro-linguistic programming is one of the method by which you can remember the things much faster, right? Much faster. So this tap is एक second में you are not remembering just the spine, but up, down, और आज जो भी सीखेंगे, all those things they will be added into it. So for revision, what you have to do, brachial plexus, when you do like this, yes, you'll be able to remember, you'll be able to revise the brachial plexus. Dekhna, at the end, we'll see this more. So this is clear, right? And we are learning this first 15-20 minutes of work. This is our ultimate aim. Our differential diagnosis that should be crisp, clean. क्योंकि पेशेंट आके बोलेगा कि सर मुझे हाथ में दर्द है, तो यू विल से कि डू यू रियली नो दिस इज स्पाइन, राइट? सुप्रास्पाइनेटस, इंफ्रास्पाइनेटस मसल होते हैं. यू डोंट हैव टू शो दैट नॉलेज टू हिम. ही इज अबाउट मुझे प्रॉब्लम क्या है, बस. इफ यू आर अ प्रॉब्लम सॉल्वर, यू विल बी सक्सेसफुल इन होल ऑफ योर लाइफ, राइट? Irrespective of in which field you are. So that's why I want that this should be your habit. It should come into your habit. कि ये दो चीज के बीच में डिफरेंशिएट कैसे करना. आई लव दैट ईमेल व्हेन यू से इट वेरी क्लियरली कि नो, आई एम नॉट वेरी क्लियर बिटवीन टेरेस मेजर एंड टेरेस माइनर. हाँ तो बोलो यार, राइट? सो दैट्स, सो वी आर मोर pertaining, more related or more interested in the clinical part. ठीक है? So this is what you know. हाँ, here it is. ये इमेज मैंने वो, इट इज नॉट इनटू दैट यूट्यूब वीडियो, राइट? बट यहाँ पे डालेंगे. This is which view? Posterior view. क्यों? Because this is the spine, right? This is the spine. ठीक? So anything above, ये तो बोलने की जरूरत नहीं. This one, this is supraspinatus. Then this is infraspinatus because spine के नीचे. But then the incomplete row, right? We see that, see, this is which edge? This is which edge of the scapula? Which edge? कौन सी?
Medial.
Medial edge. शाबाश, right? This is medial edge because क्या शाबाश, मतलब आम laterally होगा ना, right? So this is the medial edge. ठीक है? This is the medial edge. So on medial edge, if it is asked which are the muscles which are connected, so you'll say that above the spine, it is supraspinatus. Below the spine, it is infraspinatus. And in the bottom 1/3, here goes the teres
Teres
major,
major.
right? Teres major.
Teres major.
हाँ. Now teres major की खासियत क्या? Teres major will be going anteriorly, right? दिखता है ना? See, it is going anteriorly because this is the posterior. We are watching from the back. So teres major is going anteriorly. Anteriorly याद रखो ना, right?
Lady
Here,
between two major.
between. And इसीलिए मैंने ये इमेज रखी थी कि पता ही था बोलने ही वाला है कोई. Right? So no explanation needed. ठीक है ना? Okay. हाँ. So that is the pectoralis major, teres major, and in between it is the lats mastorsi. So this is done, right? This is done. But here is a small muscle, right, which is coming in between. Now this muscle is landing posteriorly, right? This is landing posteriorly. But this is the concept which you have to remember. The teres major, this teres major is this part, ye part. This one is teres minor, major क्या? Teres minor, right? So it is this teres minor which is over here, right? So it is landing posteriorly, teres major going anteriorly, and done, right? I hope now there is absolute clarity between major and minor with respect to teres. By the way, teres means, ये अपने discuss करना भूल गए थे. Teres means something which is rounded. Rounded. Right. So these muscles, when you'll see, right, they are a bit bulky muscles, right? They are a bit bulky. Though they are small, but they are bulky. So that is rounded.
Sir,
हाँ बोलो.
they are rounded in the cross section, like when we see, when we are seeing it from far away, they
When
don't
you
look.
cut like this, when you cut like this.
Yeah, okay.
Now we are adding, so the bones, we are adding this one muscle, no big thing. And this is our supraspinatus, right? Because now we are watching from the top. So that's the rib number one. That's the first rib, right? That's the first rib. Clavicle, so I won't say anything for that. And this is the supraspinatus. Now, this is the image, this particular image, right? This image. So here it is, if you're watching from the side, a very crude image, right? Consider that this is the thorax. This is the thorax, right? And then that's the scapula. That's the scapula. And this is the spine of the scapula. So anything which is above this thing would be supraspinatus. The thing which is over here, it is infraspinatus. So far, so good. But this is the scapula. This is the thorax. In between there is one muscle. This one, which are a sandwich muscle, right? It is sandwiched between scapula and the thoracic wall. So it is in between. And that's why, because it is underneath the scapula, we'll call it subscapularis. So here is the subscapularis. This is the muscle which we see, right? It is actually between scapula and the thoracic wall, right? So here it is. We see it in from different perspective. That is in front, rest everything removed. So our, see, हाँ बोलो.
सब क्लैवियन ग्रुप के पास सब क्लैवियस मसल्स रहते हैं, तो वो अटैच किधर रहते हैं?
Subclavius is underneath the clavicle. Clavius is clavicle. So this is underneath the clavicle, right?
तो उनका एक अटैचमेंट होता होगा ना, मतलब
हाँ हाँ, it will come, it will come. अभी के लिए क्या क्या, I'm not going in depth about all the attachment because you will be deviating from the topic. Right? अभी सिर्फ इतना समझ लो. Say for example, we'll be discussing scalene muscles, calenus anterior, calenus medius, calenus posterior. If we'll start going for those attachments ना, तो then you will lose the context. पहले just understand where they are present. Then attachments पता है कहाँ होते हैं? The nearest जो bone जहाँ पे होता है वहां पे उसके attachment होते हैं. It is that easy. राइट. सो जब व्हेन विल बी डिस्कसिंग अटैचमेंट्स यू विल से हाँ 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 इसमें क्या है, ये तो हाँ कुछ मेजर मसल्स हैं, तो जैसे पेक्टोरलिस मेजर तो वी डिस्कस्ड इन लेंथ because that was very important. But for these all small muscles, so I'll simply say that okay, it is on the greater trochanter, right? Greater trochanter में कहाँ पे? Let the bones come. Then we'll see in detail exact pinpoint. Otherwise, we'll lose the contacts. ठीक है? So कुछ चीजें if I'm eliminating, it is with the purpose that first the gross picture and then you become more and more clear about it. In exam, no one would ask many of the questions like which muscle is attached here, which muscle is attached. But if you make a gross mistake in the form of identifying the muscle, तो they'll slaughter you, right? Gun point पे उड़ा देंगे. So, got it? As such, I'll show you where it is attached. Right? But one thing is clear, one side is attached just underneath the clavicle. Just underneath the clavicle, right? So when you ulta the clavicle, then you'll find that there is a subclavius groove. There is wonderful subclavius groove. Exactly groove पे. इतना छोटा muscle और इतना prominent निशान बनाया because of the power of the muscle. Muscle छोटा है, right? But it is the छोटा atom bomb. It stabilizes everything. So that's why it will be generating the groove. बड़े बड़े muscles attach हुए, उन्होंने कोई impression नहीं create की because some of the slips, some of the fibers they were attached over there, but they were not making any impression on it, right? अच्छा. So here we see the subscapularis. ठीक है? Subscapularis, supraspinatus, that is the, you are master of it, supraspinatus. ठीक है? Coracoid process, grow like, no doubt about it. Subclavius, you know it. हाँ, maybe subclavius की importance, two importance. One, it steadies the clavicle. Correct? It steadies the clavicle. And for today's reference, it supports brachial plexus and the vessels. Which vessels? Axillary artery and the axillary vein, right? That is what will support. And this is what we really want to see, and we'll see that. On to the next one. Here it is. सब पता है आपको, right? There is
Sir,
no doubt. हाँ हाँ, बोलो
all
बोलो.
the muscle fibers are attached to the coracoid process, right?
Which muscles? दोस्त कौन से muscle?
Pectoralis minor
हाँ, अभी पर
is
पेक्टोरलिस
attached.
माइनर तो यहाँ पे आया ही नहीं ना, है ना?
Yeah.
यहाँ पे तो है ही नहीं.
Okay.
पेक्टोरलिस माइनर विल बी कमिंग लाइक दिस. सो अभी तो अपना कोराकोड प्रोसेस क्लीन है. There is no one. We have removed all the muscles which are connected to coracoid process. Means coracobrachialis उड़ा दिया, यहाँ पे pectoralis major minor को उड़ा दिया, right? Because we just want to build from the base, right? अभी pectoralis minor आएगा, it will definitely come. ठीक है? हाँ. So coming back to this is the posterior view where we know everything: supraspinatus, spine, infraspinatus, teres major, and the teres minor, right? All those muscles, they are seen. This is the latissimus dorsi, which is between teres major and teres and the pectoralis. Just a minute, yaar. Just a minute. They always come late. Sorry. बस कितना चल कीजिए तब तक मैं लेक्चर संख्या पे बाकी के 19 पॉइंट हैं ज्यादा चीजें आज पूरा दिन लगेगा. तो मैंने सब लिख के रखा है और वहां पे सब जगह चीजें पड़ी और जो जो लगाए हैं ना वो सारे मैंने इलेक्ट्रिक पॉइंट ये सब तो बाकी इसका ख्याल कीजिए तब तक हम so sorry. So right, so this is teres major, pectoralis major, and the latissimus dorsi, that is which is present over here. We move on to this part. This is also known to you, right? The new thing which has come, see teres major, teres minor. Now we have started using shortcuts: supraspinatus, infraspinatus, but we come across these two more muscles, right? In fact, it is one muscle only. This is a posterior view, right? As such, because the spine is seen, so this has to be a posterior view. Okay? So here, this muscle is triceps. Tri means three, ceps means head. So we are watching two of the heads. There is one more head, but it is underneath. We'll just see it in a while. So this one is a long head, and this is a long head, and this is the lateral head, right? Long head and the lateral head of triceps. That is what is seen over here. Triceps is a major muscle. So we'll be learning it in depth about its action, where it exactly it works later. But right now, just for the sake of completion of the entire structure, we are watching it over here. Teres major, you know that. Right? Teres major. And now we are rotating the body slightly, right? So see, you'll feel that rotation, right? Gradually we are rotating. So what you are watching over here, keep an eye on teres major, right? And as we rotate, right? We rotate and here it is. But this was the point, that teres major, it comes anteriorly, right? This was just for the visual impression that how it is getting generated. And it goes into that medial edge of intertubercular sulcus. So medial lip of intertubercular sulcus, that's the teres major, right? Supraspinatus, subscapularis, all those things are known to you, right? Here it is, the complete anterior view, and in anterior view, we have in fact taken the small part of chest out. So we are watching serratus anterior, subscapularis, supraspinatus, teres major, pectoralis major has been removed, right? And see these two heads, these two, right? Because we have removed the biceps. So that's why we are watching through and through. And that's the long head of triceps and the lateral head of triceps. Long head of triceps and the lateral head of triceps. On to now we now know the muscles. These are the muscles which will be coming into picture for the identification. Just 2-3 muscles are important, but we studied all the muscles to give the completeness of this particular area. As promised, whenever we'll be discussing any of the artery, we'll start right from the heart, right? So that we know that from where the source is. So here is the heart. From heart, there goes the ascending aorta. Ascending aorta goes into the arch of aorta and then goes the descending aorta. With this much description, you know that anterior, that is the ascending aorta is anterior and descending aorta is situated posteriorly, right? So that's why it will be taking a turn, right? ये चीज हर बार दिमाग में रखनी है. Now, in this arch of aorta, 3 major vessels, they come out. One is the brachiocephalic trunk, right? Brachiocephalic trunk. Then on the left side, so this is on the right side, is on the right side. On the left side, we have got the left common carotid artery and the left subclavian artery. Let's zoom it and see it more close. Here it is. No doubt about it, right? That's the ascending aorta. This is the arch of the aorta. From the arch, there goes the brachiocephalic trunk. Trunk, because it is a big artery, right? Big, thick. And that brachiocephalic trunk goes, it goes on the right-hand side. Then this is the left common carotid, and this one is the left subclavian, right? So left common carotid, it goes straight away up, right? And there is one more artery over here, and that is vertebral.
Vertebral.
That's right, vertebral, right? And these vertebrals, they will go back, right? And then they both unite and they will form which artery? Basilar artery, right? Basilar artery. Both the sides of vertebral artery will meet, and on the posterior aspect, right, they will meet and they will form one artery, which is called as the basilar artery. This basilar artery, it enters into the brain, right? It enters into the skull, and then it divides. And that's how, and these common carotids, they will divide into external and internal. External will give to face. Internal, once again, they will enter into the skull and they will form complete thing. What is formed, it is called as the circle of Willis. Circle of Willis, right? That's the supply of the, blood supply to the brain. Circle of Willis. Now see, as we are talking about circle of Willis, it is for arteries. There is nothing like circle of Willis for veins, because in brain, venous drainage is completely different. There are venous sinuses, so it is totally different. So that's why in case of brain, when we'll be studying arteries and veins, like those topics, they are totally different, right? But this circle of Willis, just keep in mind that it is with the help of internal carotid arteries, from both the sides, and vertebral artery from both the sides. But vertebral arteries, they unite together to form basilar, and that's how the complete circle is formed. And then from this circle, all those small vessels, they will be going out and they will be supplying. Yeah, it's important, Q. Because when you'll be watching, when you do the angiography, right? When you do the angiography, it says, and it is called as the cerebral angiography. When you do the cerebral angiography, as the blood is going, right, it will look like a whole network. So that is where every branch will matter. You need to know two things. One, which area, say for example, you have done MRI and you see some dark spots on long T2 right? On long T2, when you are watching those dark spots, so you know that there is something wrong, right? There is a ischemic change. When there is an ischemic change, so you will do the angiography. You do the angiography and you'll find that some branch, right? Some branch, it is showing like this. So this means this is a block. If this is a block, so that means it is which branch and it is supplying where, so which area can be affected, and accordingly you can correlate the what is with the clinics, right? With the sign symptoms. So that's the reason why anatomy is important, right? I'll show you later on, right? All these angiographies, that is also in my mind, right? I'll be showing you some very amazing angiographies, upper limb, right? I'll show you even of the upper limb also. Even DSA, digital subtraction angiography. So here it is. So this brachiocephalic trunk, this divides into right subclavian and the right common carotid artery. From here onwards, the journey on the right side and left side is absolutely same. So we move. Here it is. So we say this is the right subclavian artery and this one is the left subclavian artery. Left subclavian emerging straight away from the heart. While right subclavian, it is nothing but it is the continuation of brachiocephalic trunk just after right common carotid artery has been exited. As it exits, as the right common carotid artery goes, name changed, we now call it subclavian artery, right side, right? Journey continues. Then from subclavian, there goes one, this is just off the track because it is important artery. This is what is called as the internal thoracic artery. This artery, it goes deep into the thorax and it emerges at a very beginning. Very few arteries, they come out from this because this is a very high pressure chambers, high pressure system. So this internal thoracic artery, it emerges from the subclavian and then it goes deep, right? In thorax, it will be having tremendous importance. All right,
Sir,
so
where does external thoracic artery go?
don't worry about it, right? The external thoracic is absolutely small because this is a big one. That's why, right? That's why.
Okay.
So as it will come, I'll not be taking all those very minor arteries. वो कब पढ़ेंगे? When we'll be learning the axillary artery. When we'll say that it has got three parts. First part has got one branch. Second part has got two branches. Third part has got three branches. अभी के लिए just इतना समझ लीजिए why those muscles are important और कहाँ से ये नाम change हो रहे हैं, right? The gross picture. So here it is. The thickening. From the subclavian, we said that this is the subclavian artery. From subclavian, we now say axillary. कहाँ से? Suddenly the name changed? No, not suddenly. There is a landmark, and that landmark is here is the first rib, right? Here is the first rib. Here, the outer edge of first rib. Outer edge of first rib. The moment outer edge of the first rib is crossed, that is the LOC, right? Line of control. From this point onwards, we'll be calling it axillary artery. So axillary artery is called from the lateral edge of first rib. From first rib onwards, we'll be calling it axillary artery. Important, very important, because this is like a Viva question, right? Because they ask specifically for that. So many questions. Very fast. Confusing term, part anterior. Which posterior, lateral edge of first rib. हाँ, that is correct. कुछ doubt हो ना? It's a posterior interior वाला because now I don't know what you are asking. So तभी के तभी unmute करके पूछ लीजिए, right? Anyway, I hope this part is.
So, you can explain axillary artery.
Huh?
Axillary artery.
Axillary artery. Axillary artery. It is the continuation of subclavian, na? So this is subclavian. This is axillary. So suddenly the name changed. The name has changed with respect to first ribs, lateral edge, outer edge. As soon as that outer edge is crossed, and we change the name, right? We change the name. Now onwards, it is called as axillary artery. Clear? Right? Very simple. So Say up to this point, we were calling it subclavian, right? This is the rib. The moment rib is crossed, now we'll call it axillary. So this is the keyword. That's the keyword. So we talked about, muscle, we talked about bones, we talked about muscles, we talked about arteries. Now is the time to land for the vertebra, right? Vertebra, because this is in cervical region. Brachial plexus emerges from the cervical region, right? Neck region. From neck, those plexuses groups are formed, and then they will be going all the way into the arm. So cervical, this is the occipital bone, correct? So we call this first one as the atlas, second one as the axis. So C1, C2, and then in order C3, C4, C5, C6, C7, C8 क्यों नहीं? No, because this is T1. क्यों T1? Because this is the first vertebra, first rib. From thoracic first, the rib goes out. So that is the first rib, right? So that's why this is T1. So very clear. C1 to C7, cervical vertebrae, they are from C1 to C7. And thoracic क्यों? Because first rib emerges from that. What if a rib is emerging from here? Any rib is emerging from here, so we'll be calling that rib as the cervical rib. Just keep this thing into one corner, right? At the end, we'll be talking about it. Next time, I'll show you the even X-ray of it. Cervical rib, because cervical rib गलत जगह पे है, ऊपर है. Nerves वहां से जाएगी. So those nerves will be pressed by the cervical rib, and person will be having severe pain right from the birth. Right from the birth, because it is compressing, right? Very rare of the rare cases, it is bilateral. दोनों side होगी. Right? We have got even X-rays of that also. And what would they look like? Very delicate, thin ribs, very thin, right? Very thin. But because they are bone, the bones can compress the nerve so easily. That's why they'll be causing the compression symptoms. So here it is. We know about C1, C2, C3, C4, C5, C6, C7, and the T1, T2, and it continues, right? Now the entire game is this. This is how things will really look like. Our entire focus will start from C4, right? From C4, C5, C6, C7, and T1. C4, C5, C6, C7, and T1. We'll be spending 2 minutes for their root names, right? There is a general rule. This is like a golden rule. नाम कैसे देंगे, right? The golden rule is that when we talk about cervical root, right? So this is a vertebra. This is a vertebra. From vertebra, if you watch from the top, to then there is anterior root, there is a posterior root. So they come like that, right? And that's how all these formations they will occur. That is from the spinal cord, right? Those roots they come. In spinal cords, there are even the entire spine is divided into, say, anterior, posterior, and lateral horns, right? That lateral horn which is carrying those sympathetic, parasympathetic fibers, right? And then we have got sensory and the motor. Sensory क्यों? Because sensory is the sensations they are received from the posterior side. So posterior horn will be receiving sensory, and the anterior horn will be sending the messages to the muscles कि अरे गरम है हाथ वापस खींचो, right? So that's how all these nerves are formed, because nerve is like a conduit. Conduit means tube, and in that tube the wires are going. This is like the automation which has been done by God. As soon as the temperature is high, हाथ जल रहा है, sensation आए, brain ने बोला withdraw the hand, right? Bas, it is like that. So we need to name these nerves roots very properly. And for that, the rule is whatever the cervical vertebra on which you are, let's say we are on C4, right? We are on C4. So this root will be called C4. C4 root. We are on C5. So we'll be calling this particular root as C5. So for cervical root, the number is, it is above the vertebra, right? Above the vertebra for cervical. So here it is, let's say we आंख बंद करके C6, तो इसके ऊपर का जो रूट निकला उसका नंबर C6, इसके नीचे C7. Easy. All right. So by that rule, C5, C6, C7. So we'll call it C5, C6, C7. So far good. For thoracic, it is completely ulta. Thoracic is the root which is emerging below. So this is T1, root coming. So this will be called as T1. Here it is, right? Here it is. Say, this is T1. The root which is coming from here, it is called as T1, right? This is T2. The root which is coming below is called as the T2. The trouble comes, what about this one? The nerve root which is coming between C7 and T1. इसको क्या नाम दे? One method is we give it the name T0. If we follow that, right? So T0. T0 looks bad. So that's why it is given C8, right? So the name C8 is given, and this can be one of the question of Viva, right? We ask this question only in those cases when the candidate has answered very properly, right? And we say that C8, very C8 vertebra, right? Then why the name is like that? So this is the reason. It is an adjustment. It is an adjustment of the rule, that is C8. Is this clear? Right?
Yes, sir.
Right?
Yes, sir.
Great.
So the only reason it's C8 is because T0 sounds bad.
T0 sounds bad. हाँ कितना अजीब लगे ना? मतलब
Sir,
it
could
would
you please explain this again?
see, cervical is what? Cervical is, you want to name, let's say, let's draw it, right? This is the vertebra, right? C5. One nerve is coming out, one root, it has to be root, not nerve, root. Root is coming above it, right? यहाँ से निकलेगा. On both the sides. What name should we give to this?
C5.
Who asked the question? I want you to answer. Who asked the question? फटाफट यार अभी बहुत है.
Sir, I asked.
हाँ Vidisha. हाँ. So what number should I give it to this?
C4?
Okay. Here is the rule. Here is the rule. Rule is what? For cervical vertebra, right? This is the vertebra. The root which is coming above, that's the name which will be given. So in this case, it is coming above. So we'll call it C5. Good?
Yes, sir.
Huh. So let's draw one more. C6. So this will be called as?
C6.
Correct. C6. And this would be called as easy, C7. After that, what would come? Thoracic 1. What will call this as?
C8.
C8 क्यों? Where is C8? It has to be called as T1, na? No, because in thoracic, the rule changes. The rule is, this is T1. So what to do for it? So we have got two things. If we follow thoracic, so then we have to call it T0. है ना?
Yes, sir.
Or if we follow cervical, so we have to call it C8. Now it looks like C8 is more logical. So that's why it has been kept as C8. But as such, it is called as an adjustment. In many of the nomenclatures, you will find this thing. Right? Because as such, you want to follow the rule, but somewhere if you have to tweak that rule a bit, you do it. Right? But picture should be clear. And over here, it will matter a lot. All right. So here it is. We now remember our all-time great. This is Ram To Dur Chala, right? And we remember this only. We remember to drink cold beer, nahi karna, right? So it is Ram To Dur Chala. So it starts with root, trunk, division, and chords. That's how it will go. So first, let's start with root. Easy. C5, C6, C7, C8, T1. For the sake of understanding, just take a blank paper और मेरे साथ draw करते रहिए. Keep drawing the things along with me. Right? So you will, by within next half an hour, entire brachial plexus, you will be able to draw by yourself. So just write C5, C6, C7, C8, T1. And like a very artistic thing, join C5 and C6 and do this. C7 straight and C8 and T1 को join करके बना दीजिए. Right. So these are called as the roots, correct? These are roots. Next, let's move further. So we need to now form the trunk. So here it is. Yet this is trunk, right? You have made the trunk. More further. Now, as these nerves, they will be coming out. There is a muscle who will be creating the window. So here it is. Focus on this muscle. This muscle. This is a big muscle of the neck, right? Which will come absolutely सीधा यूं आता है, right? This is called as the scalenus anterior. Scalenus anterior. And there is one more muscle which is called as the scalenus posterior. Scalenus posterior का अभी कुछ ज्यादा काम नहीं है. Scalenus posterior is posterior. पीछे है. Brachial plexus comes forward, right? So there is a one more muscle which is called as the scalenus medius. Right? Middle में तो scalenus middle बोल लीजिए, but actually उसका नाम है scalenus medius. This is the muscle. अब see, clearly दिखता है कि our favorite brachial plexus is coming out from here. So if it is ASIC, form कहाँ से हो रहा है? All the way it is formed from above, and here it is coming all the way down. Right? अभी we'll remove all the other structures to see only this window. But this is one important window which tells that brachial plexus will be coming out of scalenus anterior and scalenus medius. Right? That's how it comes. So pinpoint we have located, this is scalenus medius and the scalenus anterior, and the brachial plexus is coming out of it. Right? Because it is anterior, it is coming anterior. It's not going posterior, so posterior has got no role. But it was for understanding. Here it is, which is still more clear. See, that's scalenus medius and that's scalenus anterior. Now it is seen perfect, ekdam first class aa rahe hain. And with whom it is coming? It is coming along with subclavian artery, right? Subclavian artery. Subclavian artery kahan tak? First rib.
Lateral edge.
After this,
Lateral end of
clavicle, it
first
becomes
rib cross.
axillary.
नाम changed, axillary artery. But brachial plexus तो साथ साथ ही चल रहा है, right? नाम बदल गए, but otherwise it is moving along with the axillary artery. तो vein कहाँ? Vein भी वहीं पे है, right? Just for the sake of simplicity, we have removed the vein, but otherwise it is parallel to that only. Artery and vein साथ साथ ही चल रहे हैं. So we removed everything, right? So we removed clavicle, and so now it is crisp clean, right? So this is the first rib, and the brachial plexus. This is the whole brachial plexus, beautiful brachial plexus, right? The arrow pointed, and this is the axillary artery which is coming along with it. So here we see. Okay, so till this point, you drew C5, C6 joined together, C7 straight, C8, T1 straight. They will be forming the trunk, right? The name of the trunk, superior, middle, inferior, right? So it is superior trunk, middle trunk, and the inferior trunk. So trunk formation to that is very simple, right? This trunk will now be divided into division. Again, easy, anterior division and posterior division. So तीन part तो ऐसे खत्म हो गए, right? Easily. That was the root, trunk, division, right? But this much, top two meet, bottom two meet, and this C7 is straight, right? Plus divided, and then now we'll see that is it really happening like that? Yes, it is happening like that, right? This is a close-up view of that. See, this is the axillary artery. That's the first rib. Right? And all of them, they are sitting on the top of the axillary artery and they are traveling. What are they forming? Well, all of them, they are into three layers, right? Three layers. So this will be the superior trunk, this will be the inferior trunk, This will be the middle trunk. है ना? So easy. So what we saw over here, superior trunk, middle trunk, and inferior trunk, in fact, they all are three in layer. With respect to what? With respect to axillary artery. See, level 1, level 2, level 3, superior, middle, inferior, right? With axillary artery. Same thing, just the zoomed one. Now comes the next part. Now these divisions, right? These divisions, they divide, right? They divide into, these trunks, they divide into anterior, posterior, anterior, posterior, anterior, posterior divisions. Now these divisions, they'll be making the chords. They'll be making the chords, right? So that was the Ram to Chala. Root, trunk, division, and we are now over here on the chords. There are three chords. The chords are medial, lateral, and the posterior. With respect to what? Again, same thing. With respect to अपनी
Auxiliary.
axillary artery. Axillary artery के medial में है medial cord, axillary के lateral में lateral cord, posterior तो posterior cord. Simple. But at what point? Because these, though, they will keep on rotating, right? So there, we need to fix a point. Okay, we'll do that, right? So here it is. This is the complete formation, right? Are you with me? C5, C6, C7, C8, T1. From the roots, you created, right? They are about to join. You created the trunk. Trunk divided into anterior and posterior divisions. So that is the division. And now we are making medial, lateral, and posterior. Medial, it has got minimum alphabets. Lateral, it has got more. Posterior, they have got maximum. बस तो posterior के लिए start उल्टा. All the posterior roots, right? All the posterior roots के divisions. All the posterior divisions of superior, middle, and inferior trunk, right? Because trunks, they divide into anterior and posterior. सारे posterior divisions, they form posterior cord. So this is done. Easy. Next one is superior and middle. This and this. Now only the anterior divisions are left out. So superior and middle, they form the lateral cord. So two divisions are needed. And medial, minimal. So that is medial will be as just a continuation of anterior division, and it is the medial cord. So thus you have learned how the lateral, medial, and posterior cord are formed. Is this part clear?
Yes.
Right?
Sir, can you
Yes.
please repeat?
Yes.
Could you please repeat?
See. These were, at least this is clear. Trunks, superior,
Yes, sir.
middle, and inferior. Anterior, posterior, anterior, posterior, anterior, posterior, right? Anterior, posterior, anterior, posterior, anterior, posterior. All posterior join. So this is what? What will it form?
Cord.
This was the division,
Posterior.
and this was the cord.
Posterior.
Right? So this would be the posterior cord. Wonderful. So it has three sources, right? For the lateral one, lateral was intermediate. It has got two sources. So for the lateral cord is this and this, right? Just for the this and this. This is for the clarity, right? I'm changing the colors for everyone. And what about the medial one? This anterior division, that's the only source. That is the medial cord. Done. Brachial plexus complete.
Yes.
Right? So that's what it is shown. Here it is, right? The formation of lateral cord, right? Lateral cord. This is the medial cord. See how wonderfully the medial cord, right? All the way going directly. right? Nothing. And over here, see, what about the lateral cord? See, the lateral cord is meeting. Lateral cord is meeting, right? Over here, this and this. So that's how lateral cord is formed, medial cord is formed. And this is where the posterior cord, right? See, this is still better. Here you can see, this is the superior trunk, this is the middle trunk, this is the inferior trunk, right? See, superior trunk, it divides. This is one branch, right? This is, and then underneath there is a posterior division. Because say side by side, if you watch, this is, it divides like this. So all the anteriorly what we are watching is all the anterior divisions. And posteriors, they will be watched from behind. They will be watched from behind. They'll be watched from behind. So these anteriors, they are meeting, right? See, this is the superior and it is meeting. This is the middle and it is meeting. And that's how it is forming the lateral cord. This, right? And see the inferior all the way going, not meeting anyone. So that's how the medial cord. And when we watch from the posterior side, this is the medial cord. And see, this is the posterior view. This is the posterior view. All the posterior cord, posterior divisions, see, posterior divisions and posterior division, right? That is what is forming the posterior cord, right? So thus we have got posterior division of 3 trunks, superior, middle, inferior, and that is its forming. Correct? So medial cord, posterior cord, and the lateral cord. So we have now journeyed till this point, right? We move from here because from here the branches will start emerging. Not very complicated. Just we take it systematically one by one. But first we understand that names of the cord. We said that one is posterior and one is lateral and one is medial. But from where? With respect to apna this, then this muscle is very right. It is our pectoralis minor. So this is the axillary artery. Correct? Axillary artery. On axillary artery lies the pectoralis minor. But it is at this point we see to take a photograph, right? Which cord is where? So names of the cords, they are given medial, lateral, posterior with respect to the artery. Which artery? Axillary artery. And where? At the point of pectoralis minor. That is just underneath the pectoralis minor. How these cords are situated, give them the name. And then once the name given, after that, wherever they go, but we'll be keeping in clear that we are dealing with these particular cords. Otherwise, so kya ki these cords, they'll change their position as they proceed further. So then we'll keep on getting confused ka isko kya naam de. Nahin. At this point of time, namkaran vidhi ho gayi, right? And then this name will be following all the way. So another important key point, right? Because these are very specific things. So even in surgery, it's like when you'll open the axilla, so you need to pick up, because randomly it is not easy to pick up the things. As you'll see in the dissection, right? It is not that easy. But if you follow this pattern, move to the pectoralis minor, and then you know that what it is, right? Beyond doubt. Here it is. Now, some important notes. The lateral cord, right? Lateral cord. Normally, lateral cord are these cords, they are like big pipelines. But sometimes from this pipeline, one connection is going out. And this connection, which we have to remember, it is the musculocutaneous nerve. Musculocutaneous nerve. Watch this now. This is the musculocutaneous nerve, which is going all the way down. Right? Musculocutaneous. Musculocutaneous kya karti hai? Because name itself is telling it will be supplying muscles as well as skin. Yes, it is supplying muscle as well as skin. And it is a big nerve. Kyun? Because it is coming out of a big pipeline. That's why it will be traveling deep, बहुत दूर तक जाएगी. Right? So, but यहाँ पे कौन से muscle वो, that we are not discussing, because we have not discussed those muscles of the arm and forearm and hands, right? But we know that this is musculocutaneous. It will be giving that. we pick up from where we left. So those chords are prepared. Now these chords, they are dividing. The major division, the most vital division is this. Can you watch? This is the lateral cord. This is the lateral cord. And this is the medial cord. Right? Artery has been removed so that we can see the things clearly. ये पीछे दिख रही है, this is the posterior cord. Right? That is the posterior cord. This lateral cord, it moved further, it gave this musculocutaneous, and then it continued. It gave one more branch, right? We'll see, but this is the big portion that is continued. So this first portion, which is marked over here, this is of lateral cord. Is that clear?
Yes, sir.
Yes.
And then we have got the medial cord. Medial cord is also coming up. It is giving some branch, but that's okay. But this is the major chunk which is going over there. So what we speak is that there is a portion of lateral cord and the portion of medial cord. They both are meeting, and they both meet to make one of the most important nerve, and it is called as a median nerve. Median nerve. So what is the formation of median nerve? Median nerve, it is formed by the contribution of lateral cord as well as the medial cord. So there is a lateral root, there is a medial root. Lateral root is coming from lateral cord, medial root is coming from medial cord, to form median nerve, and it is a big nerve, right, which will be helping us all the way down, right? So this is how it is important. Importance, this is like a circuit. This is like a circuit. So when we'll see all these types of deformities, so we need to think that they are supplying which muscles. Muscle is always in balance, flexion component, extensor component, they both are balancing, so that's why hand is remaining straight. If the extensor are working more, so then hand will go like this. If extensors are working less, but flexor is not working, then also hand will go like this, right? And the vice versa. So depending upon the condition, we'll find out that which nerves are involved, right? We'll do it today. So here it is, formation of median nerve, right? Here is a median nerve. This one is the median nerve. By lateral root, this is from the lateral cord. This is the medial root, right? So this is from the medial cord. And that's how they are good.
Sir, I have a doubt in the lateral cord. What is the dark spot on it?
Which one?
The where you have written LC.
This?
Yes, sir.
Don't think. Then I'll ask, what is this? These are some nerves which have been cut.
Okay, sir.
All those small things, they will come at a very later stage because there is a nerve which comes out from here. There is nerve which comes out of here. So instead of watching, focus this concept, right? That's fine.
Okay, sir.
Sure.
Huh?
So, in the attachment of the median nerve, both the anterior parts of the lateral cords join, or only one of them?
Which anterior?
Like this anterior part of superior and medial trunk makes the
बस एक
lateral
बात
cord.
बताओ, एक बात बताओ. C5, C6, C7, C8, T1. ये क्या बना? These are
Division.
roots, right? ये क्या बना? ये
वो
क्या
ट्रंक्स
बना?
हो गए ना, ट्रंक्स,
हाँ,
सुपीरियर
ठीक है,
ट्रंक, मिडिल ट्रंक, इंटीरियर ट्रंक.
ठीक है. Then they divide into anterior, posterior, anterior, posterior, anterior, posterior. ठीक है? Anterior, posterior, anterior, posterior, anterior, posterior.
डिवीजन है ये सारे.
So these are the divisions. Then these meet, right? This goes and this goes, correct?
ये पोस्टीरियर है,
So this is what, this is what,
लैटरल,
right?
मीडियल और
This
पोस्टीरियर.
is lateral, this is medial, and this one is posterior. What? Posterior cords,
कॉर्ड्स.
right? And now
Chords.
one portion from this, right? One portion from this, And one portion from this is making
Median.
Median nerve.
Median nerve.
तो दोस्त मेरे ये क्वेश्चन कहां से आया कि इसके अंदर पोस्टीरियर कहां से आया? पोस्टीरियर डिवीजन का कोई टुकड़ा भी है वहां पे?
नहीं सर।
व्हाई दिस क्वेश्चन आया है कैसे दिमाग में? देर इज नो पोस्टीरियर, तो साले इसमें यहाँ पे गए, देर इज नॉट अ छोटा सा भी एक फाइबर भी तो गया है नहीं। गॉट द आइडिया? ये पूरी कथा इसलिए की है, ड्रॉ इसलिए किया फॉर द क्लैरिटी कि पोस्टीरियर फाइबर्स तो जाएंगे ही नहीं ना, they just can't go posterior, they go to only the posterior cord. Got it?
Yes.
Clear or not?
Yes, sir. Yes.
है ना? With reference to your question कि whether there are anterior fibers or posterior fibers, those posterior fibers तो जा ही कैसे सकते हैं? ये तो वाइवा में पूछने जैसा क्वेश्चन है। गूगली। But anyway, it is clear ना? पक्का ना?
Yes.
So this is median nerve formation. And हाँ, now medial cord, right? Medial cord ने तो अपना कंट्रीब्यूशन दे दिया फॉर द फॉर्मेशन ऑफ द मीडियन नर्व। सो बाकी का जो हिस्सा बचा, वी आर टॉकिंग अबाउट मीडियल कॉर्ड, राइट? रिमेंबर, अब नाउ इट इज वेरी मच इंपॉर्टेंट टू गिव क्लोज अटेंशन के वेयर एग्जैक्टली आर वी। मीडियल कॉर्ड has given its contribution to form the median nerve. Whatever is left out, that moves further, and that is the ulnar nerve. Got it? So medial cord, अपना फिगर यहाँ पे ड्रॉ करो ना। सो मीडियल कॉर्ड, ये मीडियन नर्व बनाई, पर दैट जो रिमेनिंग पोर्शन विच इज गोइंग, दैट इज द अल्नर नर्व, एंड दिस अल्नर नर्व विल गो ऑल द वे टू द हैंड. It will supply the hand. It is called as the nerve of the hand. So if anything goes wrong to this portion, so then the trouble is only on the ulnar side. So ये डेड फिंगर जो है उसको तकलीफ होगी, दर्द यहाँ पे होगा, right? When the ulnar nerve is involved, and I'll show you how the ulnar nerve gets damaged. मतलब वो लगा कहीं पे, ऐसे कुर्सी पे बैठे ठाक से लगा है ना, right? All those effects are because of the ulnar nerve. Just olecranon के पीछे से ऐसे निकलती है, right? Quite superficial. Tap करो and it gives pain, right? That's why it is one of the center for torturing anyone. मतलब हाथ बांध के जो नीचे मारते हैं, so it is because it hits. In many of the conditions, it gets cord-like, thick cord-like, right? Autoimmune disorders. So here it is. Now we are on to the posterior cord. See, we are just picking up major nerves, right? Posterior cord. See how wonderfully it is made up by posterior division of all the cords. Posterior division cord means, right? Posterior division, right? Posterior division, and it forms this posterior cord. Posterior division of all the trunks, right? Posterior division of trunks, और उसने बनाया यहाँ पे cord, right? Ram to chala. We are here, right? On the posterior. As it goes, it gives one more nerve, and that nerve is axillary nerve. So see, अपने कितनी nerve सीखे? Ulnar, musculos,
Median.
ulnar, medial, right? Median, right? And the musculocutaneous.
मस्कुलोकुस्टेनस।
हाँ, musculocutaneous. So, ऊपर से, and the axillary nerve. Now it comes. Axillary nerve, which is part of the posterior cord, and the posterior cord continues. But this axillary nerve, it winds around the humerus. यहाँ पे ये मरी nerve.
Neck.
जो fracture हुआ, right? So this nerve is शहीद. So this is what is called as the, इसका नाम दिया, right? So here it is. See, axillary nerve, how it goes behind the humerus, right? And by the way, axillary nerve, right over here, radial nerve, right, which is continuing. So we saw this. And if there is fracture, so then one has to go for surgery because this nerve would be damaged. That's why this is also called as the surgical neck. There is one what is called as the anatomical neck, but this is called as the surgical neck, right? Surgical neck, which is slightly higher, right? So this is because this is a point where the axillary nerve will be winding around the humerus, and it is called as the surgical neck, right? Otherwise, bindas, apna ye posterior cord, it is continuing as another big radial nerve, right? Radial nerve, which will be playing wonderful role into the arm, right? Meantime, apna that chota sa muscle, right? See the importance of this muscle. Bilkul upar se, right? That is how high C5 and C6. From C5, C6, when it was forming the trunk. From trunk it supplies, right? आगे की बात नहीं. From trunk only it supplies के ले जाके that छोटे से muscle को पहले supply करो. Now to subclavius. Now we know that ये छोटा atom bomb कितना powerful. It is getting the supply from the roots, from the top, right? No one वो division कुछ नहीं, बिल्कुल direct message which is coming from the top. So this is the nerve to subclavius. That's the importance of this muscle. Then two nerves we know, we learn. One, lateral cord. Now the moment I say cord, Ram, tu, chala. Okay, we are talking about the cord. Which cord? We are talking about the lateral cord. Lateral cord, right? Lateral cord. Lateral cord, by the way, form कैसे होती थी? तो यहाँ पे division थे, right? Division थे. Lateral two. So this up and middle. यहाँ से this is the lateral cord which was developing. From this lateral cord, it gives one branch, and that branch is lateral pectoral nerve. Rings the bell. Lateral pectoral nerve and the medial pectoral nerve, they are the power supply of pectoralis major.
Major.
Right? So this is the reason, because it is a big muscle, so that's why it is supplied by two ways. Lateral cord, right, which is formed by C5, C6, right? C7, right? And see the medial cord में से branch निकलेगी medial pectoral, right? Thus, what's the distribution? All the way C5, C6, C7, C8 सब उसको supply कर रहे हैं pectoralis major. So that's why
सर ये
pectoralis
पेक्टोरल वाला एक बार एक्सप्लेन करो ना वापस, थोड़ा फास्ट हो गया.
draw करते हैं. आप ना साथ साथ draw कर रहे हो C5, C6.
Yes, sir.
हाँ सर.
ठीक है.
Yes.
So then it would be easy, right? I can be a bit fast in this. ठीक है. So I'm not writing everything. So this is root, trunk, cord, root, trunk, division, anterior, posterior, this and this. So this is the lateral cord, right? Lateral cord में से अपनी branch निकली. This is the lateral pectoral nerve. ठीक है? Lateral pectoral nerve. Then मुझे medial cord चाहिए. This is the medial cord. This is the medial cord. From medial cord, one branch goes, and that is the medial pectoral nerve. Both of them, they will go to pectoralis major. Got it? Right? So distribution कितना बड़ा मिला? C5 में से मिले, C6 में से मिले, C8, C7, C8, T1 सब. Right? So when we'll be discussing the pectoralis major, it is supplied by which nerve roots? So nerve roots सारे के सारे आएंगे, because it has got a dual supply. Right, in the form of lateral pectoral nerve and the medial pectoral nerve, which are coming from the lateral cord and the medial cord respectively. And lateral cord is formed by the contribution from C5, C6, C7, and the medial cord is formed by the contribution of C8 and T1. Clear? Right?
Yes.
Yes sir.
Yeah, this one image, this one diagram will explain everything. So this is done. अब तो आगे का तो एकदम easy, right? And the same way medial pectoral nerve, which is coming out of medial cord, right? So thus lateral pectoral and medial pectoral, they are giving the pectoralis major. ठीक? And C5, C6, C7, ये तो nerve to subclavius का भी बाप. Nerve to subclavius तो at least कहाँ से निकल रही थी? It was emerging from the trunk, na? It was emerging from the trunk. ये तो direct root में से. Direct root. मतलब कोई trunk ही बीच में नहीं. सीधा root. C5, C6, C7's root, they form this long thoracic nerve. And this long thoracic nerve travels. And it travels deep. Travels down. All the way down. Right? ये middle pectoral नहीं था. So this long thoracic, it travels down, down, all the way down. See, this is where it is going. And where is it going? Where it is landing? Long thoracic nerve. Naam suna? We have talked about it.
So serratus
Serratus
anterior.
anterior.
Serratus, it supplies that serratus anterior, and that's the reason कि इतनी लंबी nerve है. That female has got the carcinoma of breast. You are giving radiotherapy. This nerve is affected, right? Or injury, किसी ने छुरा मारा, कहीं पे भी मारा, the nerve गई, right? And as soon as this nerve is damaged, serratus is damaged. Function of serratus is to keep the scapula near to the thorax. नहीं रहा,
Winging
then
of
that is-
scapula.
That's right. It will lead to winging of the scapula. Very right. Now this is in general. यहाँ पे सब आ गया. This image, right? कुछ नहीं है. This image is from Chaurasia, BD Chaurasia में से ली हुई है. But this is where it will give you the clarity कि क्या क्या है. So this is where C5, C6, C7, C8, T1, these are the roots, and then roots, they form the
Sir,
trunks.
please zoom it. No, it is not clear vision.
Okay, okay.
Sir,
Now,
excuse me. I want to ask something, sir. Can
हाँ
I
बोलो
ask?
बोलो बोलो फटाफट.
Sir, in this anatomy upper limb, we can refer BD Chaurasia.
We are referring BD Chaurasia.
Okay,
बिल्कुल.
okay.
और शुरुआत से मैंने कहा बीडी चौरसिया जो है दैट इज गुड. हाँ, अगर जो आपको ऐसा लगे कि नहीं मुझे थोड़ा और सीखना है, जानना है, तो देन इट इज
Yes,
फाइन.
sir.
यू कैन गो टू ग्रेज एनाटॉमी, बट इट टेक्स टाइम. Honestly, it takes time.
Yeah. BD Chaurasia is a initial stage to learn, sir.
हाँ, तो
Yeah,
इट इज
it
बिंदास.
is.
हमने भी पढ़ते थे.
Okay, sir.
ग्रेज एनाटॉमी वाज टू मेक द बाइसेप्स एंड टू इम्प्रेस द गर्ल्स. ग्रे पढ़ रहा है, बाकी वो ग्रे ऐसे रख के अंदर बीडी चौरसिया ही रखते थे. ये तो सीक्रेट बता दिया. मतलब ग्रेज इज फैंटास्टिक यार, बहुत अच्छी बुक है. हेनरी ग्रे को सलाम यार, इतनी डिटेल में, बट इट इज इन टू मच ऑफ डिटेल. इट्स टू मच ऑफ डिटेल. थक जाओ मतलब. और फाइनली कोई पूछे कि क्या पढ़ा, पता नहीं. यू जस्ट कांट एक्सप्लेन, राइट? खुशी बहुत हो अंदर से, पर फिर उतना ही दुख हो. So C5, C6, C7, C8, T1, right? Now you know that these are the roots. Then the trunk, they divide into divisions. Divisions, they lead to formation of cords. Cords, they lead to branches, right? How much we have learned? We have learned these things. One, from the root, C5, C6, C7, right? There goes the long thoracic nerve, right? The long thoracic nerve, which emerges straight away from the root, right? So this straight away from the root, ye gayi. So that is a long thoracic nerve. Done. अभी के लिए, for the time being, these muscular branches and dorsal scapular, उसका बहुत टेंशन मत लो, right? This, let them come. Then branch to phrenic, right? Which goes to the diaphragm, because ये सब thorax में आएगा. This we know. Now to subclavius. Now to subclavius, right? वो बोला कि it goes from superior trunk. There is one more artery that is suprascapular. Suprascapular, right? नाम बता रहा है कि it will go above the scapula, right? So that is the suprascapular. This area is super interesting. This is the area which is commonest damage most commonly. 6 nerves meet. With 6 nerves, right? 6 nerves meet. Here is 1. This is 2. Root of C5, root of C6, they come over here. This is suprascapular nerve and the nerve to subclavius, 3, 4. And the anterior and posterior division, 5 and 6. These are the 6 nerves which are meeting over here. And this is the area of vulnerable area for the damage. Okay. Meantime, this is what I have summarized. ये कभी कभी मत भूलना, this portion, what we have drawn. For axillary कहां से निकले? Watch this. This is from the posterior cord. आंख बंद करो. Posterior cord was made by all those posterior divisions. Posterior divisions, they were making the posterior cord. ठीक है? Where is posterior cord? Here is the posterior cord. This is the posterior cord. Posterior cord was doing what? Posterior cord was dividing into 2 nerves, axillary nerve and the radial nerve. Crystal clear? So over here, axillary nerve and the radial nerve, they are from the posterior cord. ये कभी मत भूलना. Never forget this छोटा सा portion, right? Rest is all automatic. You'll always remember. You'll never make mistake in formation of lateral pectoral nerve and the medial pectoral nerve, because name itself is telling that they'll be emerging from the lateral and the medial trunks, right? So cords. So you'll never make mistake in that. But this Axillary and radial, they are from posterior cord. Ulnar, ulnar kahan se? Median cord. Medial cord kahan se? Medial cord was just the direct continuation, right? So this is the medial cord, this one. So jo anti division jo directly continue ja raha hai, right? One portion will go here and one portion over, and it will be leading to formation of median
Median
nerve,
nerve.
right? And बाकी का जो है continue आगे गई, that is the ulnar nerve. So it means when you are dealing with medial cord, it will lead to formation of ulnar nerve, right? Or lateral में से there was that musculocutaneous. These are the four major nerves which will be distributed across the entire upper limb. That's how they are formed. You have to really, the homework part is you have to really draw this entire thing 2, 3, 4, 5 times till it is imprinted into your brain and you can draw it clearly. Regarding all these upper subscapular, now to latissimus dorsi, this, all these things, they can be eliminated, right? Muscular, medial cutaneous nerve of arm, forearm. Let those areas come. You'll automatically remember, right? But abhi ke liye, the nerves which we discussed, they should be crisp clear. That is, you should be knowing, you should be able to draw all the way till the cords, and from cords, axillary, radial, ulnar, musculocutaneous, and how you will be forming the median nerve. That is the contribution of medial and the lateral cord, right? That's it. If you draw this much, it would be more than enough. This is what you have to do, right? On to the injuries. On to the injury. We'll be dealing with site causes, nerve roots, muscles, deformity. So this is the order in which we'll move. This is the order which is for surgery, right? Whenever we talk about any of the deformity, that this has happened, right? This has happened. So if this deformity has happened, so which muscles are involved? Those muscles are involved. Why? Because muscles work only when the brain tells them. Brain tells them that by the wire, and that wire is nerve, right? What has happened to that wire? Whether that wire is sending more signals or it is cut. If it is sending more signals, muscle would twitch. That is convulsions.
Seizures.
Right, seizures, right? And when it is cut, that is not working, right? Because muscle has got no strength. So that is what should be the cause and where is it occurring, right? Where is it occurring? So it will give the distribution. If anything is happening, main power junction chala gaya, main board mein se, पूरे घर की light गई, right? But that is what is called as the ELCB, Earth Leakage Circuit Breaker. Then it gets distributed into what is called as the MCB, Miniature Circuit Breaker, which is for per room. So suppose this room ki light gayi, so we know that there is a MCB for computer room, right? You just switch it on. You know that only that much. Rest of the light is not affected. This is how the power is distributed, but no reward to any of the electricians because पूरा idea चोरी किया हुआ है भगवान के पास से, right? This is what God does. There are relay centers, amazing relay centers. The first what we learn is Orb's palsy. Orb's palsy, that was the point, right? Where 6 nerves meet. Orb Duchenne palsy, this is the full name. Wilhelm Orb, name of the scientist. But Duchenne, the Bolden, right? पता नहीं Duchenne ने अपना नाम फिर छोड़ दिया. That's why it is called as the Orb's palsy. Site of injury, 6 nerves meet, and that is called as the Orb's point. So here is the Orb's point. This one is the Orb's point, right? Which we discussed. That's the Orb's point. Why it happens? When someone falls on the shoulder, right? Someone falls on the shoulder. This is in case of adult, right? Gire. And exactly it is that point which is damaged. Or this is more common, right? Usually shoulders, so they have got strength, itni jaldi break nahi hote, but in birth injury, there is something which is called as the head presentation. So baby is the fetus, right? They go like, they come out like this, the head first. So when the head is delivered, right, those shoulders, they are like this, and they will be easily negotiated. But sometimes the position of the baby is this, which is what is called as the shoulder presentation. Now in shoulder presentation, now this shoulder, it won't be coming out from the birth canal, right? It won't be coming out. So what they do, right? They put the incision and then this hand is taken out first and then the hand is pulled. Imagine the baby. right? When the hand is pulled, this is called as the shoulder dystocia, right? In shoulder dystocia, when the shoulder is pulled, so it will give tremendous pull over the brachial plexus, and the brachial plexus is damaged, right? So when the baby is born, right, the injury has occurred, right? And what would happen in this case? The deltoid is injured. The arm, the typical arm, ये आपको करके ही देखना है. The arm will be hanging, right? Arm will be hanging, adducted and medially rotated. Now do this, right? Immediately you will know that yes, this is what is called. So if you see any of the bacha, right, post birth, and you will find that normally baby will be sleeping like this. But if the baby is sleeping like this, right, you know that there is garbage, right? Definitely this is a case of Erb's palsy. That brachial plexus has been injured. So arm is hanging, adducted, and the medially rotated, right? This is the position of the arm. Still, game is not over. For the forearm, right? You have to do everything. Forearm is extended, right? Now the forearm could be bent. No, forearm is extended and it is pronated. This is pronation. This is supination, right? So this is pronated. Up karo, right? Arm, first you'll take care of arm, hanging, adducted, medially rotated, forearm is extended, pronated, right? And then comes the hand. It is like this, right? So situation will be like this, right? Internally rotated, this is extended, and then like this, it is flexed. This is what is called as if किसी से वो रिश्वत ले रहे, right? ऐसे करके style में. So porter, that's why it is called as the porter's tip or the waiter's hand, right? जिसको policeman hand भी कहते थे. और वो बेचारों की क्यों insult करना, इसलिए even YouTube पे भी मैंने, let's not insult them, but the real name is policeman tip hand. सही में. So that's the situation of the hand, but it recovers fast. Right? Because if the injury is not very extensive, nerves recover. If it is grade 1, then within few days only, you don't have to do anything, it recovers. The next one is
So
the
it recovers by itself.
sorry.
It recovers by itself, like you don't have to do anything for it.
Self. You just have to support it. And you have to tell the parents that under any circumstances, you will not be lifting, "Kare mera baby karke aise uthaya." Nahi, that will not be done. Right?
Okay, sir.
Because people तो अरे मतलब पूरे रिश्तेदार, अरे कितना सुंदर है, अरे इसकी आंखें इसके जैसी उसके जैसी, मतलब they are like, ठीक है, but in such serious cases you have to be very strict, and then people even scold you.
How by self it is done, sir?
Huh?
How by self it is done?
It is the body's mechanism. It is the body's mechanism, right? Because the cells are regenerating, so it regenerates. That injury, that regenerates.
So in case of adults,
Huh?
in case of adults, if this is seen, it's recovered by
So
itself.
that is when, yeah, good one. That is the point when you have to really evaluate the injury, because in adult, if the nerve is absolutely torn, you need to go for surgical repair, and that is not 100% efficient. They might get some sensations back, but वो हाथ तो फिर ऐसा weak रहता ही है for very long time.
Okay, sir.
And in shoulder dystocia, you are pulling, but you are an obstetrician, na? You know that this injury can occur, so that's why you won't be giving a pull like बिल्कुल मतलब a rough pull, right? You'll be giving a pull उतना ही कि मतलब in controlled way, right? So that's why it is, but still it can occur. So that's why it gets repaired also quite effectively. But this Klumpke's palsy is bad, right? It was defined by Augusta Klumpke, right? This is a case when either the injury is on C8, C9 root or the trunk, right? The lower trunk, that is damaged. So ये कैसे कि कोई गिरा फर्स्ट फ्लोर पे से और बीच में कोई पत्थर आया, ईंट आई, सेकंड फ्लोर पे से गिरा, फर्स्ट फ्लोर के किसी ने तार बांधे थे तो वहां पे पकड़ लिया, राइट? या anything, कोई tree, any branch of the tree is held. So now just एक हाथ पे पूरे body का वजन, right? And then it pulls, it rips apart. So that is where the multiple muscles are involved, right? And this is dangerous. This is dangerous. Even in gym, sometimes it happens कि when they go for extreme weight, right? Or they say down key and then suddenly it goes up and it pulls, right? It can lead. और फिर कितनी देर तक ऐसे हाथ पकड़ के रखते हैं, right? But because of the machines, that pull is not that strong, but still it can happen. But when it is injured, full-fledged injured, now we'll be talking full-fledged injuries. The muscles, right? We know that there are two types of muscles, intrinsic and extrinsic. Intrinsic means, say, for example, if we consider this joint, the muscles which are starting from here, ending over, they are called as intrinsic. The muscles which are starting outside and they cross the joint, so they are called as the extrinsic muscles, right? In this case, the muscles which are involved is, first is flexor carpi ulnaris, flexor carpi ulnaris. Now, let's not do any of the guessing. I think I have put. So these are the muscles, flexor carpi ulnaris, pronator teres, pronator quadratus, and the muscles of the hand. Here it is, I put it, right? Flexor carpi ulnaris. Watch it in your own hand, right? This is your hand, and one side is, this is, you take the pulse over here. So that is the radial side. This is the ulnar side. So flexor carpi ulnaris, carpal muscles, right? Those carpal muscles over here. So flexor carpi ulnaris, so its function would be flexion, right? Flexion from the carpal bones. So that is flexor carpi ulnaris. Then we have got muscle over here and muscle over here. So this is what is called as the pronator, who is taking the hand like this, right? From supination position to pronation position. So that is the function. So one which is near the wrist, it is called as the quadratus because of the shape. Because of the shape, it is called as quadratus, right? And one which is round and bulky, right, which is near the elbow. So that is what is called as the pronator teres. So this is pronator teres and this is the pronator quadratus. Thus, we are dealing with the three major muscles, right? No doubt there are two other muscles also, flexor digitorum profundus and flexor digitorum superficialis, but hang on for a minute. So this is the first muscle. This is the second and this is the third. Function is easy. Flexion and the pronation. These are the two things, but now these muscles are lost. Right? Because of that injury, these muscles will not be getting the nerve supply. So what really happens? What really happens is when the flexor carpi ulnaris is damaged, right? So its function was to do the flexion, right? Kyun this is because it was supplied by ulnar nerve. Yes, we know that the posterior cord, right? जहां से मतलब the lower C8T1, right? This was the trunk, right? This was the inferior trunk. From here, the ulnar nerve was eventually coming out. Flexor carpi ulnaris is supplied by ulnar nerve. Ulnar nerve is damaged. So now flexion is not possible. Flexion nahi hai to extensor bola कि मैंने क्या गुनाह किया है. I'll keep on working, right? As we said that our hand is always in balance. Extensor and the flexor. So now the extensors, they are normal. Nothing has happened to them, but hand will be like this because flexors are unable to flex, right? So that's why extension ne aise kar diya. So this is wrist is extended. This is the deformity which will be happening, right? Then pronator, the name itself is telling those two pronators, pronator teres and the pronator quadratus and the pronator teres, those two muscles, their function was to do pronation, right? But there is a muscle called supinator, jo ulta lagta hai. Supinator will become the boss, right? So forearm will be supinated. वो ऐसे करे तो भी यूं, because it is not working. ये क्या हुआ? Yeah, back. So our wrist now is extended, right? So it is extended, and forearm is supinated. Now in hand, something happens to the hand also, and it is classical. These are the carpals. Then we have got the metacarpal. Then these are the phalanges, right? So the joint which is over here between the metacarpals and the phalanges, very rightly we'll be calling it metacarpophalangeal joint or the MCP, right? Metacarpophalangeal. Right? And we have got, now these are the phalanges. So we'll call this as interphalangeal.
Proximal.
Interphalangeal, that's right. But there are two, very right. There are two.
Distal.
One is distal, one is near. So one which is near is called as the one which is past is proximal interphalangeal. One which is dur is called as the distal interphalangeal. Right. So we have got now, we know about three types of joints, PIP, DIP, and the MCP joints. Something very typical occurs over here. This is right. So proximal and distal interphalangeal joints. So these metacarpal, so here is the complete thing what is written. It leads to claw deformity. Now this you have to do. In claw deformity, metacarpophalangeal joint. Where is it? Metacarpophalangeal. These are the metacarpals, these are the phalanx. So this joint, it would be like this. Normally, if this is flexion, this is extension. Now this is hyper extended, so it goes like this, right? And PIP and DIP, proximal interphalangeal and the distal phalangeal, they are flexed. So situation will be like this, claw, right? Here, MCP is hyperextended and PIP, DIP, they are like claw, right? So this is how it really happens. That's why it is also called as the total claw deformity. Total claw deformity. And these are the reasons, right? This I have written just कि आपको थोड़ा अंदाज रहे, right? Otherwise, when we'll be discussing hand, at that point you will really relish कि हाँ ये मजा आया है, right? Lost muscle, there are muscles called intraosteal and lumbricals. They are intrinsic muscles. When they fail, so their intraosteal and lumbrical, they do what? They flex at MCP joint. MCP joint, they do the flexion. Now that muscle is not there, so it will hyperextend. Their function is interphalangeal joint. They do the extension, right? Because of the web. So they do extension. Now they are not there, so that's why because these muscles, they will be losing their function. So that's why these functions, they are also lost. So iska ulta deformity mein hua. So active forces are now extensor digitorum, which is on the back side. So it will lead to hyperextension of MCP, right? And then there is flexor digitorum superficialis and flexor digitorum profundus. Flexor digitorum profundus, because these muscles, they go, their tendons all the way supply onto the opposite side and then they pull, right? So they will flex PIP and DIP. But let these muscles come, right? This is just for your information. Don't worry at all, right? ये याद नहीं रखना अभी, till we see those muscles, right? When we'll see those muscles, you don't have to remember. You will remember it in second. But claw hand deformity, वो पता होना चाहिए, right? Now this is the bonus. This is usually which is missed. The bonus behind it is that when we say C8 and T1, they are damaged, but from T1, some important fibers for the sympathetic system, they go. Sympathetic system is what? Fight and fright response, right? Fight and fright. So when the sympathetic fibers, they are gone, so that fight wala nature hi chala gaya. This is how we have to remember. Because it is T1, that's why it will be affecting head and eyes only, very high. Right? Because from thoracic, as it goes down, then it starts supplying heart and lungs and liver and right, all those things it supplies. But here the T1 is at the highest level. So sympathetic fibers, they will be supplying to the head and neck and the eyes only. First thing, sympathetic. Whenever you want to fight, so you will be keeping your eyes big, right? Ladna hai, right? As much as things which you can watch. Over here, sympathetic fibers gone, drooping eyelids. Drooping eyelids, right? आँख खुली नहीं रह रही. That is what is called as the ptosis, right? आधी खुली आंखें. that is ptosis. Then even the pupils, they will be widely dilated when the sympathetic, right? Aankh to khulli hai, but pupils be dilated and let the more light come in, let the more information come in. But now, no, uska ulta. Pupils are constricted, right? So there is excessive constriction. That is what is called as the meiosis. When person is fighting, there is so much of circulation, fast circulation is going on. So that's why there'll be so much of sweating. Abulta, no sweating, what is called as the anhidrosis, that is the absence of sweating, right? 3. Then comes, right? 3. Then comes eyeballs as if they are sunken, right? It is called as anophthalmosis. Anophthalmosis, मतलब एकदम deep eyes. Just. And then comes the 5th part. This 5th part is the most interesting one. This 5th part is like, first, take this, that whenever there is a painful stimulus on the neck, right? If someone pinches on that side of the neck, the ipsilateral means kya? Ipsilateral means, we learned that.
On the same
Same
side.
side.
Correct, on the same side. Right? So, yes, ipsilateral means on the same side. Ipsilateral ka ulta?
Contralateral.
Contralateral.
Contralateral. That's right.
Contralateral.
It is the contralateral, right? So over here, the side on which you pinch the neck, that side of the pupil will be dilated. होता है ना, मतलब कोई pinch को दे, right? Right. So that is machhar kata, the U, right? Big eyes. So this is called as the ipsilateral dilatation of pupil. This is a reflex. Reflex means it went to T1, T1 में से bounce होके वापस आ गया, right? कह रहे मच्छर ने काटा, चलो पकड़ो मच्छर, right? So that is the spinal reflex. Now that thing is gone. So it is called as the ciliospinal reflex that is lost. So that's why there won't be any dilatation of the pupil. Even if you pinch very hard, right, there won't be that. So that is what is called as the ciliospinal reflex is lost. So this is what is called as the combination of all these things: ptosis, meiosis, anophthalmos, then anhidrosis, and loss of ciliospinal reflex. That is collectively called as the Horner's syndrome. Syndrome means where there is combination of all these things. Not necessarily all the 5 things can occur together, right? Sometimes 3 things occur, sometimes 4 things can occur, but something will definitely occur. So this is what you'll see in case of clump case paralysis, clump case palsy, right? Worth watching because it will be telling just by looking at his symptoms, you'll be able to tell that even the T1 is damaged. Let the MRI report come, but before that, you are very sure from the clinical side that there would be damage of T1, right? And people keep on surprising sometimes that before watching MRI, you say कि हाँ T1 damage निकला ना, and they'll say कि क्यों कहाँ से पता चला? Simple है ना? Now तो you just saw the patient, right? बिल्कुल सूखा सूखा सा ptosis है, guaranteed it is the T1 is damaged, right? So that is what is called as the Horner syndrome. ठीक होने में it takes hell lot of time. This is a bad thing, right?
So nerve damage is treatable.
Nerve damage is treatable, but when we'll see that in nerve damage, what level it has been damaged, whether it is a damage to level 1, level 2, or it is a complete resection. When there is a complete resection, no scope. It never comes back. Right? Even after years together, there might be some minor recovery, but it never goes back to the normal state, right? But if it is only level 1, then it is okay. वो तो आ जाता है, right? Now this was so funny. And this is one of the conference in which I happened in China, where this Shehbaz Sharif met this Putin, right? And he was struggling to put that earphone, right? Earphone. And this happened in 2025, and it happened in 2022 also, right? She is Palki Sharma, right? I follow her, right? Very intelligent girl. So she said that at least he should have spent some time learning how to wear those earphones. And then Putin is explaining that, okay, this is how you have to hold it and just wear it. And he struggled twice. Then he said, can someone help? Right. So it was a very funny thing. All right. So thank you so much. Right. See you soon with the next
Sir, I
topic.
was attending that meeting, so I
You were-
slept late.
Yes, yes. It was so funny. I also saw that. So that's why I thought of putting it over here. All right. Take care and we meet soon.
Thank you, sir.
Thank
Thank you,
you.
sir.
Thank you,
Thank
sir.
you, sir.
sir.
Thank you, sir. Have a great day.
Same to you. Thanks.
Thank you,
Thank
sir.
you,
Thank you,
sir.
sir. Thank you, sir.